All right, hi. I'm Dr. Ben Newman, and I'm a coronavirologist. Let's get to your questions. Next question is from Victoria. How you doing, Victoria? Let's see. Something I've been wondering. I know there have been studies on sewage to try and understand the prevalence of COVID-19 because it's in urine. I think it's something like that. And it can be a good early indicator. So why don't we have a pee on the stick test for COVID? Awesome question. All right, fine. Yeah, the answer is so there's a nice study from South Korea where they look at actual COVID patients. And these are people that are in hospital and they've tested positive by one or the other, like saliva or up the nose tests or in the cheek tests, and one of those things, where the air comes out, basically. And of these people, they look and see whether they can recover virus from urine, from serum, like bloodstream, and from feces, which is poo, They conclude that it is very hard to find any virus at all in urine. Now, part of that is that urine is full of this stuff called urea. It's, I think part of what makes it kind of yellow, and be probably some of the components there will be part of what makes it smell bad. That's some of those free amines. And so urea knocks the heck out of proteins. It's like really good at just unwinding and destroying proteins. When we want to wreck a protein, just really wreck its world in the lab, you put it in like 6 molar urea and this thing is gone. This beautiful structure just turns into loose spaghetti that does nothing. It's very nice. So that's what you would find in urine, and things like the spike protein on the outside of the virus are going to be essential for that virus to actually infect another cell or even stay protected. And so urine is basically a SARS coronavirus destroying substance. Should we coat the entire world in urine? No, that sounds unpleasant, but that's why you don't find much urine there. And I guess if the virus grew heavily in the bladder tissue, for example, then you would probably find more of it there, because there might be some that were just released and then you go to the bathroom and so you could still find it there. Very low amounts of virus in the serum, like circulating around the body, which is backed up by some of the other studies that I've seen. Most of the others can't detect it at all, and this couldn't detect any live virus, or rather they didn't look for live virus like actually able to do anything, but they were able to find some copies of the genome. So it could be there, at least in a little amount. Where you find most of the virus is in feces. So it wouldn't be a pee on the stick, it would be a poo on the stick, and generally people don't like that kind of thing. There are also enough mixed contents in human poo that you would have trouble. There would be inhibitors of some of the testing in some people's sample, and that is potentially a problem, which would mean that it could be there but you may not detect it because it's just as gross and hard to work with in a molecular sense as it is in all the other senses. So that's why. But testing fecal samples, if you can do the extraction right and sort of clean up all the bad stuff and just keep the virus, and there are ways to do this, then that's actually a pretty darn effective way of checking who is sick and who is well. And it's a good way of catching long-term cases. You may have somebody who is positive like a month after the start of infection, but still potentially shedding live virus. And that is quite often a pretty good way to tell who those people are. So there you go. Yeah. It's a very gross Ask Dr. Ben, but whatever. You asked for it, I have to deliver it, I guess. Thanks very much. This has been Ask Dr. Ben.